I'm Dr. Anthony Claude. I'm a board-certified psychiatrist. This video, I'm going to talk to you about mental health myths versus psychiatric realities. And the first thing I commonly hear is cannabis helps with my anxiety. Cannabis often has a compound in there called THC, and THC is very psychoactive, meaning it can cause the mind to stimulate, to race. So what happens is people can smoke cannabis and then they may feel good, and during the high, they may find it calms their anxiety, helps them sleep, maybe it helps with pain, but there can be psychiatric consequences of smoking. For example, there could be a withdrawal. People can actually get more anxious from smoking cannabis. It can affect their motivation. So actually, psychiatrically, we recommend not to smoke because the harms outweigh the possible benefits of smoking. And I have a whole nother video about cannabis in more detail if you want to watch that. But that's one of the common myths I see in a clinic setting. Another thing I commonly see is people cannot concentrate and they assume they have attention deficit disorder. Now, not concentrating can be from a variety of things. Depression or anxiety can cause people to not concentrate. If someone is having difficulty sleeping, they're not going to be able to focus or concentrate as a result of it. So yes, problems concentrating or focusing can be due to attention deficit disorder, but not all the times. There are several other factors that can come up where someone cannot concentrate. Another thing I commonly hear is, I have insomnia, I need medications to address the insomnia. Well, trouble sleeping can be a variety of things. It could be not doing proper sleep habits, maybe it's too much screen time, maybe it's using the bedroom for studying or for reading or for napping. And so it's just hard to shut off the mind to sleep. So if someone has trouble sleeping, the medications are not the first resort. Typically, we recommend to make sure they're practicing sleep hygiene. And sleep hygiene basically is having healthy or good sleep behaviors or patterns for at least 30 days. And to try it for at least 30 days before considering medications to help with sleep. And I have whole separate videos about practicing sleep hygiene or good sleep hygiene that you can watch. And there's also other conditions that can affect people to not sleep well, like obstructive sleep apnea or central sleep apnea. And some of those conditions really need a sleep study to be thoroughly evaluated for. Another thing that's commonly thought is God is all you need. So there's some truths to this, and that God does help healing come for sickness and disease. But oftentimes, God can work through the medications or can work through the doctors and therapists and psychologists to help bring that health and healing. So I think the misconception is people will say, God will heal me and I don't need the medications or I don't need the doctors. Well, perhaps God is healing you through the medications and through the doctors. Another myth is that medication will be all I need to treat my symptoms. Now, medications are important and for oftentimes are an essential part for treating mental illness. But not all the times does someone need medications. Sometimes it's better addressed just through therapy or counseling. Maybe there's childhood traumas, or maybe there's certain relational dynamics that are going on where someone is having symptoms of anxiety or depression as a result of the dynamics that they're experiencing. And so in those aspects, the therapy is going to be incredibly important to help with the symptoms. And yes, the medications may be helpful at some point, but oftentimes you have to go deeper into the emotions and feelings and to try to find out what it is that's causing what someone is going through. A common myth I hear is medications. Will the medications make permanent changes to my brain and body? And so oftentimes the medications will not make permanent changes to the brain and body. The brain and body are highly adaptable. The brain is very neuroplastic, meaning there's so many billions of neurons and dendrites and they all communicate with each other, and it can really change over time and adapt to what happens to it. The same with the body as well. Now, there are some exceptions to this. Of course, medications have to be used with a caution, and there has to be you should be aware of the possible side effects of it and weigh the benefits of the medication versus the possible side effects. But for the most part, they will not cause permanent changes to the brain and body. Another common myth is that medications will make me feel numb, or that medications will numb my emotions. And yes, there's some truth to this, and that the medications can numb the feelings of the emotions, but often it's because these emotions are too intense. and people need to work through it or process it or have it be less intense so they can function in their life. And so the medications can bring down the intensity of these feelings or emotions so that people can have more ability to work through it and to process it and to get past it. And a lot of times the mental health conditions in itself cause people to have numbness in their emotions or feelings. For example, post-traumatic stress disorder can have emotional numbness. People who dissociate or have been trying to escape from the painful realities that life offers tend to numb their emotions or feelings just so they don't feel the pain and suffering. And so, yeah, sometimes medications can numb the feelings or emotions, but oftentimes, if it does, there can be a purpose behind it. Another common myth is that you can just snap out of it. Now, oftentimes, there's a lot of factors that lead into someone seeking psychiatric care or mental health treatment. Perhaps it's environmental factors, maybe a relationship breakup, maybe a job loss, maybe they have a genetic predisposition to it, like maybe anxiety runs in the family, and so they also have anxiety and need to be treated for anxiety. Maybe there's other factors involved like drugs or alcohol. Not everyone can just snap out of what they're going through. A lot of times it needs an evaluation by a trained professional to help people work through what they're going through, maybe to get some education if they need to change anything in their life. But oftentimes the medications and therapy are going to be important when someone is in mental health distress. Another common myth is don't ask or talk about suicide. Actually, in a psychiatric or clinical setting, it's encouraged to, if someone's having suicidal thoughts, to ask them about it. And it's a myth that they will actually kill themselves or be more likely to act on the suicide if it's talked about. In fact, if the people talk about the suicide, it's going to help them to almost release it out of their mind, and it actually makes them less likely to commit suicide or hurt themselves down the road. That's according to studies done by Columbia University, and they've really evaluated this in detail by Columbia Suicide Rating Scale, in which there's a series of questions that we can ask, like how long have you had the thoughts for, how many hours during the day, do you intend to act on them, what's preventing you from acting on the thoughts, have you acted on them in the past, basically a series of questions. And going through those questions actually helps prevent people from committing suicide or having suicide attempts in their future. Another common myth is that mental health and physical health are not correlated. In fact, there's a big correlation between the physical health and mental health. When someone's going through a physical problem like pain or sleep apnea, that can affect their mental health. And conversely, when someone's going through a mental health like anxiety, depression, that can worsen their physical health, including worsening people's perception of pain. And so there's a big correlation between physical health and mental health. And when you improve one, it often improves the other. So those are some mental health myths versus psychiatric realities. Hopefully you like this video. Be sure to like the video for more videos like this one. Subscribe to the channel, help to support the channel. Thank you for watching.